Only your doctor can determine if Apokyn is right for you. This video will provide you with information that may help you to talk with your doctor.
I can tell when I'm going down or when I'm having an off episode in a number of different ways. I start to slow down considerably. I start to search for words. I find speech difficult. And eventually I start to freeze up.
Many people with advancing Parkinson's disease have periods when they lose control of body movements, even though they take their oral Parkinson's medicines as they've been prescribed. These off times or off episodes can cause motor symptoms such as muscle stiffness, slow movements, and difficulty starting movements. Fortunately, there's a medicine that can reverse off episodes for many patients with Parkinson's disease. It's called Apokyn, also known as apomorphine hydrochloride injection. When used during an off episode, Apokyn may help people with advancing Parkinson's disease walk, talk, and move around more easily. Although oral medicines are used to control Parkinson's disease symptoms, off episodes may still occur. Apokyn is a prescription injectable medicine that may reverse off episodes for patients with advancing Parkinson's disease. It is used in addition to oral Parkinson's disease medicines. Apokyn is not a narcotic and does not contain morphine. At the beginning of this video, we heard about the symptoms one Parkinson patient experiences during off episodes. However, different people can experience different symptoms.
Anybody that has Parkinson's can list on a moment's notice the various symptoms and how debilitating they can be.
My feet feel like they have concrete blocks on them.
My gait starts to slow down, walking becomes a problem.
Well, of course, the physical part is pretty tough. It's not any fun at all.
I have a shaky feeling inside.
My toes start to curl.
That's why I'm getting really sluggish, and I can't hardly move. I can't hardly get out of that chair.
You wonder if you can get to the water bottle on the table or pick up your coffee cup.
Because you cannot do anything, really.
As we can see, there are a number of off-episode motor symptoms. The list includes tremor, difficulty speaking, rigidity or muscle stiffness, prolonged muscle contractions, slow movements, difficulty with dressing and walking, difficulty moving, and Parkinson's mask. Just as patients experience different off-episode symptoms, they can experience different types of off times.
The mornings are the worst time because what happens is when I get up in the morning, I have gone the whole night without any drugs in my system.
My off episodes usually occur almost every time when my medicine's about to run out.
There was a time when I was actually in New York on business, and I was in a restaurant, and I felt this off episode coming in a hurry.
I may be playing with my grandchildren, and I may not even be able to get up out of the chair.
As you've just heard, some off times are predictable, some are unpredictable and occur without warning. Apokyn can be used to reverse both kinds of off episodes. In clinical studies with Apokyn, many patients experienced a significant improvement in their off episode motor symptoms within 20 minutes of an Apokyn injection. Ken is an Apokyn patient. To look at him here, you wouldn't know that he is troubled by significant off episodes, but he is. That's why Ken's doctor recommended Apokyn. Let's join Ken for a doctor's visit to see how Apokyn works for him. We'll see how he responds to a special test of motor function, both during an off episode and after treatment with Apokyn. As you will see, his symptoms are quite significant. But Apokyn has been proven effective for off episodes in a wide range of patients, including those with minimal disability.
Now, if you would, sir, hold your hand straight out in front, and then touch my finger and then your nose. All right, sir. Well, let's do this then. Let's take your right hand and tap your fingers, big and as wide as possible. You'll notice how he tends to be very slow. Let's try the other hand. Same thing. Good, then take both hands like this and rotate rapidly in a circle as much as you can and as quickly as you can.
Both at the same time.
Yes, sir. Again, you can really easily see here the asymmetry where the right hand is clearly slower and has less excursion than the left, but both are clearly abnormal and very slow. And just like that, my friend, let's see you stand up if you can. And if you can't, I'll help you, so don't worry. Okay, good. Go ahead and straighten up and let your hands relax at your side. And let's see if you can walk here in the office.
Are you close?
I'm right here with you. Notice the tremor of the hand when he's walking. We call that an overflow tremor. He can't seem to get those feet to go very far forward.
It's been about 20 minutes since Apokyn was injected. Let's see how Ken is doing now.
Touch my finger and then your nose as quickly as you can, so we can see his speed is improved. Let me have you take your right hand and tap your finger like this, real wide and fast. Take both hands and go like this for me. Rotate them through a circle, all the way around.
That was a hard one.
Big and fast. And just like that, sir, stand up for me. Good. Hands at your side, and let's walk.
Doctors can use tests like those you've just seen to measure the effectiveness of Apokyn. But when you get home, the real test is how Apokyn works for you.
If I was getting bad and I'm getting shaky and I know what's coming, I would get my Apokyn. I take it everywhere I go with me. I don't go anywhere without it. Wherever it needs to be to do this. It's not hard. It just takes just a little bit of time. A little fat. Doesn't hurt. You hear it click as it's going down. Wait 5 seconds and take it out.
As you've just seen, a specially designed injector pen with a very thin needle is used for self-injection. Apokyn must be injected just under the skin, not into a vein.
So, it's been about 20 minutes since I gave myself the Apokyn injection, and as you can see, I'm doing and feeling much better.
I had heard about Apokyn and I wanted to try it. I could not believe that somebody could be in a restaurant, get in an off position, and they could be better and get up and walk out of that restaurant, and that would be the most wonderful thing to me. Being that you have to inject yourself, I thought I could never do it. I was scared to death. But I mean, it didn't really hurt at all.
Actually, the needle that we use is so thin, it's no more than a mild annoyance. For me, trading a stick with a tiny needle versus being on the floor and not able to function, it's a no-brainer. I'll make that trade every day. And whether you're at your kid's football game or whether you're sitting in a boardroom, if you don't know how you're going to be able to control your body, it's really a drag. Apokyn does away with that uncertainty.
I try to put one thing on my calendar every day so that I have something to get up for. And Apokyn has helped me with that. It's helped me do the things that I want to do. Apokyn's one of the best things that I've ever had.
I've been taking Apokyn for approximately 4 years now. Without it, I'm not sure I'd be sitting here in my office. This morning, I was able to brush my teeth. I was able to tie my tie. I was able to button my shirt, my cuffs. I was able to function and grab on to the everyday things that I used to take for granted.
Clearly, Apokyn works for these patients, and it has worked for others, but it's not for everyone. Only a doctor can determine if Apokyn is right for you. You may respond differently to Apokyn than the patients in this video. Apokyn may not be effective for everyone. You should not take Apokyn if you are allergic to Apokyn or its ingredients, notably the sulfite, called sodium metabisulfite. Do not take Apokyn if you are being treated with certain drugs called 5-HT3 antagonists that are used for nausea and vomiting or irritable bowel syndrome. People taking this type of drug with apomorphine had severely low blood pressure and blacked out. Please review the important information at the end of this video. You may be wondering if Apokyn is right for you. Only your doctor can determine that, but you can start the conversation. Ask yourself these questions and those on the discussion guide that came with this video, and share your answers with your doctor. Do I have off episodes even though I take my oral Parkinson's medicines? What motor symptoms do I have during off episodes? How many off episodes do I have a day? Be sure to take the completed discussion guide with you to your next doctor's appointment. It may help you and your doctor decide if Apokyn is right for you.
For anybody that hasn't tried it, that's battling Parkinson's disease, you owe it to yourself to try this.
Apokyn has helped many patients with advancing Parkinson's disease by reversing their off episodes. It may be right for you. Talk to your doctor today. You should be aware of the following important information about Apokyn. Apokyn must be injected just under the skin and not into a vein. Your doctor may prescribe a medicine called Tygan to help prevent nausea and vomiting. Some patients can stop taking Tygan after using Apokyn for some time. Some patients may need to continue taking Tygan to help prevent nausea and vomiting. Talk to your doctor before you stop taking Tygan. If you experience shortness of breath, fast heartbeat, or chest pain while taking Apokyn, you should call a doctor right away. Apokyn may lower blood pressure and cause dizziness and fainting, especially when starting treatment or if the dose is increased. Patients should not get up too fast from sitting or after lying down to minimize these problems. Some people taking Apokyn may get sleepy during the day or fall asleep without warning while doing everyday activities. Until it is known how Apokyn affects your ability to stay alert, you should not drive a car or operate machinery. Some people may notice soreness, redness, bruising, or itching at the injection site. Changing the injection site with each injection and putting ice on the site before and after the injection may help lessen these effects. The most common side effects seen in clinical studies with Apokyn were yawning, sudden uncontrolled movements, nausea and/or vomiting, sleepiness, dizziness, runny nose, seeing or hearing things that are not real, swelling of hands, arms, legs, and feet, chest pain, increased sweating, flushing, and unusually pale complexion. Please see the full prescribing information that came with this video.